Hi, Dr. Gibson, Kohli here for Snackable Health, and we are talking about the rise in blood pressure that's been seen during the COVID epidemic. Talk to us a little bit about what you're hearing, Pop.
Mike, I was alarmed to see this data because we know that hypertension is a silent killer. We know that more than half of Americans are hypertensive, with three-quarters of them having very poor blood pressure control. And the fact that the blood pressure has gone up, for men and women, but more so even for women and the elderly, to me, I really worry that the next curve of the pandemic is going to be the chronic disease curve.
I agree. We talk a lot about how people have avoided coming into the hospital with heart attack, and that's upped, the risk of death from heart attack. But you're right, Paul, we may see a whole tail to this whole thing of excess death and disability due to the lack of management of chronic disease. And I'm not sure we know if this is a lack of access to medicines during the COVID epidemic, if it's a telehealth thing where people just aren't getting that kind of interaction with their physician or healthcare provider. What do you think? What do you think the underlying cause of this is?
I actually think there's many different mechanisms. Lack of access, we're being more sedentary, perhaps more alcohol use. Some of us have gained weight, but I even think that the possibility that the virus is directly affecting our blood vessels, because we know that it has receptors on the blood vessels, also needs to be explored further. So really lots of different mechanisms. But one thing's for sure, Mike, we have to get that blood pressure down.
So, Paul, what are you telling your patients?
Mike, I'm telling him to go into damage control, take those meds, lose that weight, cut down the alcohol. The new year is coming, make some resolutions, and really get your life back on track, because we're still fighting this and we will be fighting it for many years.
You may be done with COVID, but COVID's not done with you. Keep up the work.